Okay, go ahead.
All right. Well, thank you. Well, thank you everyone for joining. I'm starting right on because, like, as some of you noticed, the presentation is kind of long. Hopefully, it won't take long. I have a tendency to speak fast, so slow me down if I speak too fast. But maybe we can just start with introductions. I think we're expecting just one more person, Dana, but she'll be here later. She's the student who's been working with us. So I'm Preeti Irani, and I am one of the co-chairs of this work group. And Laura, if you could introduce yourself.
Laura Robertson, the town planner.
Right. All right. And Margaret? Cannot hear you, Margaret. You're on mute.
There I was being so good. Margaret Brennan, member of the committee.
Yeah. All right. And Liz, are you on?
Yeah. Hi, my name is Elizabeth. I'm a member of task force. I'm with and also with you, and I'm glad to be here.
Thank you. All right. Sabrina?
Hi all, Sabrina Seeger, member of the group.
All right. And Dustin?
Hi, I'm Dustin Mitchell. I'm also a member of the group.
All right. Great. Thank you. Yeah, I got 3 people saying they have conflicts today. So, but this is a busy month and there was no way I could move the meeting. So we're going to have the meeting. And people said they'll watch the recording and catch up. So I'm going to, usually I have an activity, but I'm going to jump right in because there'll be enough time for discussion. And so I am going to see, I think I can move this here. And let's see. And let's see, share. Let's see, share. Let me try again.
Google made some updates. So it's a little bit different now, but if you, it's still that present now with the square and the up
Yeah.
arrow. Yeah.
Yeah. Yeah. Yeah. Let not. I'm just going to. Okay. So I am here. This is fine. Yeah. You can see it, right? I think it's coming up.
Yep.
All right. So, okay. So today is actually more on the data presentation. This is our most data that we're ever going to talk about. So as usual, I kind of wanted to start with some quotes which kind of guide as a focus of where we are going, and there are 2 of them. One by Eleanor Ostrom. She was an economist, a political scientist, and was the first woman to get a Nobel Prize in economics. There is no reason to believe that bureaucrats and politicians, no matter how well-meaning, are better at solving problems than the people on the spot who have the strongest incentive to get the solution right. And there's James Baldwin who says, if one really wishes to know how justice is administered in a country, one does not question the policemen, the lawyers, the judges, or the protected members of the middle class. One goes to the unprotected, those precisely who need the law's protection most, and listens to their testimony. And both were very strong advocates for having people's voice, authentic engagement. And so you kind of will see as we move towards that. But so today I'll kind of give a presentation on selected data, review what we've done in the past. Dana is going to join us late, so I kind of put her presentation later, a little brief thing on the self-assessment pilot that she's kind of coordinating, and we'll have these discussion questions. Our meeting in September, at this point, with the high risk, it's probably going to be virtual or hybrid, but we can talk about it. And copy of the presentation and handouts are on the shared drive, and there's a tiny URL address there. So one of the conflicts when I've always done this charge and I've put this bold, but I noticed there's a tension in the group and even in the task force. What is our charge? Okay, great. We're supposed to do all this shared understanding. Is it planning or implementation? What do you think, based on the chart? And you can talk, we're a small group. Or you can write.
Well, I'm sitting here thinking, I guess I'm an implement person. So, but I'm
Right.
not sure that's what the task force is charged with.
Right. Right. So,
I'm
yeah.
getting the feeling that all it is identifying issues and then leaving it up to other people to change.
Right. So if you look at the charge, and this is the tension I have with the task, with even our work group and task force, some folks want to just go ahead and do stuff. Our charge at this point is planning. And the reason for that is because what we do will take sustained effort. We're trying to change a system. So, we can't go in and out. It has to be sustained energy. And the system has a tendency to go back to its original form, right? So you need a lot of partners. We have to know, we have to build relationships. So at this point, the phase is planning. And we're supposed to come up with the recommendations from the task force to the town. At this point, we're just a work group. We've not even brought it up before the task force. So that was the main tension. We're not, so I just kind of wanted to point out at today's meeting, we'll really begin talking about how do we maintain dialogue, what kind of data we collect, and we may just start talking about measures, but we'll probably talk about more about that at the next meeting. All right. So again, our ground rules are to trust that we are coming with good intentions, maintain an open dialogue, respect each other, see who's not in the group and how we can kind of bring in the voice to work together to co-create. And again, to see where the connections are between the work that we do. So one of the things that I think we're ready to do now after, since starting work in April is begin to write a report of all the work we've done since April. So this is an outline, why racial equity and justice, the process. We talked about complexity, systems, shared understanding, our findings, every discussion, what is left to be done. And then the appendices, we'll have more details. So, whoops, sorry. So this is the outline. So why racial equity and justice in Niskayuna? Because it increases life expectancy, well-being, and resiliency. It regenerates vibrancy of the town, society, and planet, and supports a nurturing environment, optimizing value towards a dynamic town. So there are all good reasons for why we want racial equity and justice in Niskayuna. And this is, feel free to question, but this is something I'm kind of repeating it, but repeating in a different way. And the first two meetings was actually very new for me, talking about systems. I had done it once before, but I tried it with you. And in both times, I got blank looks, to be honest. It's very abstract. People said, what are we talking about? Why are we talking about this? Why aren't we doing something, But I did talk about, that we are working with a complex system. We talked about well-being. We have to build on strengths, and we have to bring people in. So we talked about three things. We talked about systems thinking. We talked about the well-being framework, and we talked about targeted universalism. Why is that? So if you look at that cartoon there, I'll probably redraw it, but it was the best thing I could think of. You try to make something simple. A leads to B. But when you look out of the window, the world is much more complicated. Things don't behave the way you expect them to. We are working with people. We are working with, people who sometimes are not very rational. And it's very tangled. If I was to make a change in this diagram, I would put it towards where we want to be. So we want to be kind of see where things are interconnected. We want to have everybody to have well-being and resilience. And we want everyone to feel included, right? So when you work in a complex system, you have to know what the endpoint is. But getting there is very tangled. Really, that's what that cartoon is. And so that's why I keep talking about systems thinking. And then people say, are we done yet? In systems, in a complex system, you're never done. You do something and there's another reaction and you're looking to see, hey, is that unintended? Is that good? Is that bad? What can we do? So you're always looking out for something. So we identified 3 themes. One was, and I put here well-being resilience across the lifespan. I put well-being resilience/resilience because they're connected. Well-being is how you feel at a particular point in time, and it's governed by many influences. And resilience is when things go not according to plan, you can bounce back. So they're 2 sides. They're kind of connected, but they're not the same thing. And so the emphasis of that is emphasis on inclusion and social cohesion. Then opportunity to thrive was the other theme. Emphasis is on community wealth building. That's jobs, quality jobs, housing, supportive connections. And we had said justice for all. And we had got this idea, this way of thinking about it from St. Louis, Missouri. But after I did that, I attended actually 2 meetings, one at the state level and one at the school district. And I noticed they were very careful with how they talked about justice. And they really talked about restorative practices and fairness. And so I thought we are talking about justice, but let's call it fair and restorative practices for all. And the emphasis is on access to opportunities. Words are important. So that's why I kind of bring that up. So then what we did was we came up with these 3 draft missions. What does it mean to have well-being and resilience across the lifespan? By 2030, nurture an inclusive and sustainable environment where all feel a sense of belonging, are valued, depended on, and matter. Then opportunity to thrive. By 2030, support ecosystems of opportunities in our community to strengthen economic, social, and natural assets for all. And fair and restorative practices is by 2030, build bridges and break down barriers, ensuring everyone in our community has access to a good quality of life. So those are our 3 mission statements. Then we talked about criteria for our focus groups and for our policy or program interventions. Focus, we wanted where town has we can make something, a difference when we work on this in the town. The data are available at least at the county level or at the regional state level. Data was always an issue. We knew that. And we didn't want too many things. We said between 3 and 5 areas. For policy and program interventions, efficacy, that this approach will help, it's efficient, impactful, it'll make a positive contribution, and feasible. We have the capacity and will to implement, and then have potential to adapt or develop tools that can be used in the community. And then if it's linked to a local, state, national, global initiative, it'll add validity, allow working to standards, and make work easier because we're a town. Some other work will be done by the others. We can lean on it and adapt it for our use. So then at the subgroup meeting, between last meeting and this, we came up with several ways to do this. So some of the pathways we talked about, these are major initiatives. Lifelong learning is what the school is discussing right now, the school board. That's their mission statement. Positive and adverse childhood experiences, it's kind of linked with trauma. Inclusive, age-friendly communities. Climate resilience is a big issue right now. The circular economy. Community wealth building, these are all issues that are being worked out at the state or local level. Sanctions and restorative practices, and historical context. That one, we didn't talk about the subgroup meeting, but one of the members talked about it. It's being practiced at the school, it's being practiced somewhere else. And if you don't put it there, we may lose sight of it. So any case, and then we had to work with a lot of partners. So this is what we discussed at the last subgroup meeting. There are some challenges. We not always have town-specific data because, we're relatively a small town. Racial ethnic data is not always available. And using a wide-angle lens is a challenge for some. We're used to working at an individual level, and now we're working at a town level. So we have to kind of broaden our lens. So that will take some practice. So when I do this data now, we can questions are discussion questions, to think about as we go through. What do we want to learn? What are we doing right? How can we build on it? And what are some annual markers of racial equity and justice, that can mark the progress of our work? So what are we doing right? The town created the Task Force for Racial Equity and Justice, which is kind of amazing because our population is predominantly white, right? So that we have issues though, and they recognized it. So that's amazing that the state
And
required.
able-bodied. They're
What's that?
white and able-bodied.
White and able-bodied, right? I get that. So there, it's a majority. So we are working with folks who are in the minority, and we're saying issues are important. So the town with a lot of other towns and municipalities created a police reform plan, and they are also in the process of kind of now developing an implementation plan. And the school district has come up with a strategic plan for equity. So these are all good beginnings. We're all working with the same intent. So how can we strengthen this work? So then I looked at this. This part is a little tedious, but it's important to do it because we need to know what's available before we figure out what more we need to get. So these are all the data sources who kind of I picked up from. And so the first one is well-being related data. So this is for the town of Niskayuna. Oh, I meant to change that. So this is for the town of Niskayuna. Poverty is high among females, middle-aged males, and children. So you see this kind of bar chart. On the left-hand side with the page is below poverty level, and the gray is above poverty level. And the top half is females, but age from infants to 75 and over, and below is males. And you see the beige bars are higher for females. Then they go higher for males over here, 35 to 44, 55 to 64. And you have some children who are probably related to some of this. So there is poverty in Niskayuna. So that's really what this says. So then if you look at school-wide enrollment, you see predominantly white, 73, 68 to 73%. Asians are pretty high. And then you have the blue, which is Hispanic. You have green, multiracial, and you have black, about 5%, 4 to 5%. This is the enrollment. What this one didn't give, and we have to ask the school district, I don't know how many years, whether this is 1 year or multiple years, I don't know. And what is the total number of students they're working with? They've given us the percentages. So that's
Aren't
something.
those school years at the bottom? Isn't this a selection of 5 school years?
This is May. Where is it at the bottom over here? May 2021. No, I put it. That was presented at the school board meeting.
No, it says 15 to 16-year-olds, 16 to 17-year-olds, 17 to 18-year-olds.
Yeah. Oh,
that's the age group. Sorry, thank you.
I see. They could also be years.
Yeah, thank you. I'll put that. I just grabbed it. I did a green screenshot. It's years. You're right, Dustin. I didn't think
So
of
it's
it.
school years as opposed to chronological years of students.
Yes, I would hope we don't have that many 20-year-olds in high school.
Right. Well, and this also gives us racial information. Like, it's very important to know that, but it also doesn't tell us the other diversity we have. And we're constantly forgetting about our other diversity. How many are English as a second language? How many are blind? How many use a wheelchair? How many are deaf? How many other is there? This only gives us a synopsis of skin color.
Right. And those are the questions. This is not a perfect graph, but it's a good start. And that's why we have a lot of questions for the school. So what we'll do is write up all the questions, so we're not kind of bothering them all the time. And they will be one of our key informant interviews that we will follow up with more information on. But you know what, Dustin? I'm wondering whether Dustin has a point about this. Is it years or is it, I mean, this is what the school district did.
That's age.
Age, right? I'm like, now I just considered it age, but I just picked it up.
Yeah,
Well,
I
I
think
don't
this is
understand why 16-year-olds would be included in 2 columns and 17-year-olds would be included in 2 columns if it is age.
Right. Let me, you know what? I will pick out this, but thank you. Thank you for, I'm going to go back to the
That makes
actual
sense.
presentation. All right. So let me see. So I'm just going to stop sharing for a minute. Maybe I misunderstood it. So,
And it also doesn't give us any socioeconomic factors that come into play for the school district.
okay.
Again, it only gives us a very brief lens of what diversity could mean. And it doesn't give us a totality of diversity in Niskayuna.
Yeah, they give for proxy very often for socioeconomic is reduced lunch and free lunch, right? They have
I
that
don't think
data.
that's as strong of an indicator as we would like.
What
Many
data?
families do not use free or reduced lunch.
Right, but that's what the schools use. What indicator would you like from them?
I'm not sure what other indicators they have.
Yeah, no, I'm just saying this is what I see in the school report cards. So we can, but these are good questions, right? So we will ask them, but I have to, let me just go to my, the shared drive, okay? Because I put this presentation. Thank you, Dustin, for asking that question. I may have totally misunderstood it. So let me go to NISKI best practices and pull that up. It's 6:20. Let's see, here we are, drive. Let's see, come on, handout. Okay, here we are. Okay, I'm going to share this now. Hey, what happened here? Okay.
Pretty, I just have to interrupt you and say goodbye. And
Yes.
I'll see you
Thank you.
hopefully next month. Thanks.
Yeah, see you. Thank you. All right. Dustin, I will clarify this. It may be years, like you said. Yes, Dustin. 15 district-wide school attendance.
Yeah,
I think
it's
Dustin,
school years. Because if you go back up, it says enrollment, student enrollment, district-wide student enrollment. So those are the school years.
right. 15, 16, 16, 17. Right. All right. So I'm going to stop sharing here. And let me get that out here. And okay, and slideshow. All right. So let's go back here based on Dustin. So we have school years 15, 6. So basically in the school year 1920, 68% were white, 16% Asian. It's about 16% Asian, about 68 to 73, 74% white, about 4 to 5% black. So over here,
You're
student
not
attendance.
sharing, just so you know.
We're not? Oh, you're not seeing it?
No. Are others? It could be me.
No, you're right. Can you see it now?
Yeah.
All right. So Sabrina, your point is well taken. They have not talked about disabilities. They have not talked about ESL. Okay. And that's part of equity as well.
Yeah.
And then
just full disclosure, I have a lot of issues with Niskayuna and their equity. They are not equitable at all, nor any of those things. So
yeah, no, I hear you. I think it's like I said, it's a start. It's complex. It's issues that we will continue to ask questions about, but we want to gather all the questions at one time and we go to the school rather than take it in bits and pieces. That's
Definitely.
the second phase. We'll be doing some key informant interviews, and school is definitely one of them.
And I have another question just as to the buckets that they're put in.
Mm-hmm.
Hispanic is for any type of Latinx, any of those buckets, it all goes under Hispanic, and Asian is also anybody.
Yeah.
What is the definition of Asian? Is it Indo-Asian?
It's a very big, yeah. It's not, Asian is a problem bucket, to be honest, because it's not disaggregated. It's everybody. Right. You could be Guyanese and you would be here in the Asian, because the Guyanese very often. So race is a tricky one, and you'll find a lot of discussion about how do you really capture race. And actually, I put some in our resources section. But this is what we have right now. But basically what this shows is that the Black have more chronically absent. I still don't know what N is, what that number is, because they've just given percentages out of how many students. I don't know. Also, we don't know why they're chronically absent. So those are like questions. Maybe the school district knows, we can ask them.
Preeti, one second, sorry.
Yeah.
How can Guyanese added to Asians?
That's what when you read up, that's what they have of Asian origin. So they sometimes may check off the Asian box. Race is very complicated. There's an article in the resource section. Take a look and see why people sign off as a particular race. It's very complicated. So the main thing I get away from that is people think they're one race, and people sometimes, when they see them, you put them as another race.
Right. And if you've ever seen the forms, which I'm sure you have this much room to fill out what you want to fill out. So what you are is not on a box to check. And there's no other to check off and put in. So, I mean, they're skewing it to put it into these buckets to begin with. So we don't get an accurate idea of who identifies how.
Yeah. No, you're right. So I'm going to keep going. The other one, so you'll see I've pushed different things. Now, ACEs, adverse childhood experiences, are you familiar with that term? I brought it up in the subgroup discussion. It's basically when you have, this was research that was done, came out in 1998 with Kaiser Permanente and CDC. And basically you have, any kind of what they call severe stress when you're young. It could be substance use in the family. It could be domestic violence. It could be sexual abuse. It could be neglect. It could be a number of things. And when those are basically, if a child may have more than one or none, but as the number of ACEs increases, you have a lot of risks, which may be related to behavior and physical and mental health. And if these adverse childhood experiences and trauma are not addressed, it has physical impacts your health physically, and it's multi-generational. So this is really groundbreaking research, and people are beginning to take a stronger look at it, but we've still not integrated in our work that we do. But when the ACEs survey was done in New York, basically they did it across the different regions of New York, and they found, say, Capital Region, we would fall under this. You see, the ACEs across the regions are about similar, and New York City is lower, and everybody wondered why is New York City lower, because they don't pick up their phones basically to respond to a survey.
Well, and anyway, there's no mention of language either in any of this. And I mean, if you're a deaf kid who's going through ACEs and you don't have language access to any of the information going on, I mean, that's even yet another ACE. If you're blind and you don't have access to Braille to understand what's happening.
Right. Yeah, ACEs is, the main point behind this is there is trauma. You have now ACEs, and now you have studies that show there's expanded ACEs, which is more different trauma, which includes historical trauma, and they create serious problems in life. This is another slide regarding high school students. This is a surveys are very expensive to do, so you very often it's difficult to get Niskayuna specific data. Though Margaret, who left the call, said that NCAP had done a survey on student sadness and depression, which I haven't seen. But again, over here you see high school students who felt sad and hopeless, and throughout the years. So 2019 was before the pandemic, right? And so there's surveys that say after that it's probably higher. But this survey could not be done in 2020 because it's a school-based survey. And then among adults, there was an international survey which says basically loneliness and social isolation is generally higher in the United States and UK. Generally, according to literature, loneliness and social isolation is higher among the younger group, teens and young adults, and among the older age group. So that's just some, I just selected some for us to think about. Then there's the opportunity to thrive. And this was median household income. We had presented it last time, but this time I kind of did that with their margin of error to give you a sense. So the first slide compares the blue one is white. And because there are more whites, it's a smaller margin of error, which is the shaded part. While the orange is African American, and you see basically what that means is this is a sampling over, this is the community 5-year estimates. They take it over 5 years and then they take a median, which is supposed to be more stable for smaller populations like us. But you still see that the margin of error is high. So anytime they sample, they could have gone as low as this or as high. But what was interesting about this, their median household income in 2019 for African Americans kind of went over the Caucasian one. That was just interesting because I've never really seen that for Niskayuna.
Well, it looks like that was well within the margin of error, though. So
it is, yeah.
That may just be measurement error. There's really no conclusion to draw.
No, you're right. And these will have to be updated when the census starts releasing their results, 2020 census results in fall or early next year. The green one with the green shading is Asian compared to white, and Asians generally have a higher median household income. But as Sabrina said, it's a very big bucket for Asians. It's very often not disaggregated. And so that's a problem. There was an interesting presentation with NYU, which showed what happens when you disaggregate data. Which
I'll put in Hispanic and Latino. Those are
huge. Yeah. And they have, but over here, generally, you find that they're going in the downward direction. And again, the margin of error is high. And over here, the estimated number of households by race and ethnicity in Niskayuna.
Can you help me understand the margin of error in the first of those charts? I don't. It looks like there's a triangle cut off from the lower right that cuts off both the African American, the Black and African American margin of error, and the pink and the blue both look like they're cut off at a diagonal there. I don't understand what happened to the blue margin of error at that point.
This is the way it generated based on the margin of error. Okay. It's basically done from a calculation. That's the shading. It's not cut off.
So there's no margin of error, zero margin of error for 2019 for the blue line.
For the blue line, there is a little bit.
Well, I don't understand how the margin of error ends for the blue line midway between 2018 and 2019.
It's smaller. There is a little shading, right? You don't see the shading?
Well, I do. I mean, I do, but it ends cut off right with the pink line. Like, I don't understand graphically what this is meaning. And what I would like to know is, did the bottom range of the pink margin of error really go up to above 320,000, or is there some like white triangle that got superimposed there accidentally?
No, it's a plus or minus. I'll send you the table that came from. Okay. So I'm going to go on here. Now I go back again to the school data. And I thought this I put in under opportunity to thrive because it is very often you take AP courses because very often if you want to go to college, you take AP courses, and colleges look at AP courses and as an indication you'll be able to take on a heavy load, a college load. So they look at whether the student is able to work with difficult courses. And so I put that as it's as something for if you want to go on to college. That's why students, AP courses sometimes I think are crazy. I mean, they're like too much for high school students, but you have to take it if you want to go to college. So if you go, so that's why
Since COVID hit, I would disagree with that. I would disagree with
no,
it.
you're right. No, ACTs have not counted so much.
SATs, and AP classes. Colleges are doing anything they can to get enrollment. So they are not looking at AP level classes anymore.
Okay, but this is what the AP participation is, all right? And this is what was done in 1920. Let's see what happens in 2020. You're right. I'm not in favor of AP, but I know the competition and why students take AP classes. It's crazy. But any case, over here, my only question was this was all AP courses, and I just wondered if they could do it by STEM and not STEM. And the only reason for that is if you're looking at higher paid occupations, they tend to be STEM related. And that's what St. Louis did, Missouri. They looked at STEM and not non-STEM. There's Dana. Hi, Dana. This is town of Niskayuna labor force participation. Who's in the labor force for males on the left side and females, and what's the different groups. And the topmost one is not in the labor force. It's a little less for females, little more for males, but about the same. And only 3.2% of the at least population in Niskayuna are unemployed, according to the ACS. I'm going to go quickly through this. This was an interesting one. Sabrina, you will like this one. The CDC Social Vulnerability Index. They've been using it just to predict how susceptible a population is. So it's on 4 themes: socioeconomic status, household composition and disability, minority status and language, and housing type and transportation. And so here it is, they had for Schenectady County. All right. And then they also had it for municipalities. If you kind of know where Niskayuna is, so this is all of Schenectady County. See, Niskayuna is on the, you can't see my finger here, but on the right-hand side, you see town of Niskayuna. Yeah. And it's like towards the lower end. But if you look at, say, housing type transportation, you see it becomes darker for Niskayuna. Race, ethnicity also becomes darker for Niskayuna. Socioeconomic, I think more as we go towards Schenectady, it's a little darker. And housing, composition, and disability is definitely darker in Niskayuna. So this was interesting because Niskayuna didn't always come out lighter than the rest of the county.
Well, Niskayuna also doesn't have services in place for the vulnerable.
Right.
I mean, Schenectady has a multitude of services for vulnerable populations that Niskayuna does not.
Right. So then I come back again. This is again opportunity to thrive. So this one I looked at teacher employment in Niskayuna. So here are the students. You have 3 circles here. The top left-hand side, it says 71% white, 17% Asian. So Niskayuna teachers and professional instructional staff are 98% white. Again, they don't have language or disability out here too, or anything. And over here, they put administrative support and everything together, 93% white. If you only put administrative stuff, it's even higher. So basically they're saying the staff don't match the student population, and they need to recruit and be better at that. But I don't know how many applicants they get from the different, groups.
Niskayuna is one of the lowest paying districts in the area. especially for administrative and for custodial positions.
Okay. Then over here again, opportunity to thrive, I put owner occupied by race ethnicity for the town of Niskayuna. Of the owner occupied households, 89% is white, 2% black, 6.5% Asian, and 1% Hispanic or Latino origin. This is the subgroup recommended it because this was like a community wealth building, intergenerational kind of wealth. So they suggested we have this. This is United Way, comes up with these asset limited, income constrained employed workers for Schenectady County. And this is for the different municipalities. So here in Niskayuna is 22%, who they consider are asset limited, income constrained. So this is the working poor, as we call it. So then I come to fair and restorative practices for all. And here you have student suspensions. Again, if you look at throughout the years, it's black is the highest, the lowest is Asian. Again, I don't know the numbers, that's just the percentage. This was from the police audit report. You see overall arrest, Niskayuna residents are just 17%, Schenectady residents 44%. If you look by race of drivers, traffic stops, 57% white, 27% black, and then you have 5% the others. And then there was this interesting one, age of arrestees, 2015 to 2020. And you saw under 20 was 113. This is over, 5-6 years. And I just don't know, my question over here was what happens to these very young people who are arrested? That's where the restorative practices come in. What happens? I just don't know what happens. Do they all get sent somewhere? And those are the questions we would need to ask. This is about food access. We know that there are folks in Niskayuna who are hungry, right? And so this is from the USDA site. And over here, Niskayuna doesn't come out as a high risk. It's lighter. But again, when you look at the CDC vulnerability index, you just wonder, there seems to be some discrepancy between this and what we see out there. And so we need to search a little bit more. This is, I know Laura Robertson is on, so this is for her. No, this is a Capital District Climate Smart Communities map. It's a little old, 2013. I think they're coming out with a new one, so I put it over here. This is greenhouse gas footprint, and Niskayuna is 15.37.6. Schenectady is lower, but because again transportation is high in Niskayuna, I don't know, so we are a little higher, not very high. While for our energy cost of living, Niskayuna is again the second kind of lowest over here. So climate issues are going to be coming up, and I know they're going to release more recent data, so I said we'll keep a placeholder there so when we do that. So my question to you is, what insights have you got so far from this? And I know one of the things Sabrina has been very vocal about is equity is not only skin color. So I get that. We have to also talk about disabilities. We have to talk about language. The one thing that actually struck me when I initially thought of working on this, I thought, oh, well-being is schools. And then I realized schools have well-being. Oh, all three of them. This is, there's justice, opportunities, and well-being, that every one of us have roles in all three. So that for me was, you can't just put put sectors in silos. So that was something I learned. So any other insights? I am just going to keep this, but I'll see if I can write, and so you can see what I'm writing. So view, let's see. Can you kind of see this, right? So over here, I'm going to say, Equity is not only skin color, teams, but across sectors.
Mm.
And we have questions on each of the slides. How do you measure priority in schools? You can ask them. So what I would like you to do is, if you think of questions, if you could just email them because, yeah.
I don't know if it's poverty though, because people in poverty will reach out for certain systems that are already in place. It's the working poor who will
Okay.
not work out, who will not reach out.
Okay. Working poor. And that's the ALICE. That's what United Way gets
Yeah.
at. Any other insights?
How are they really breaking down the silos, the buckets of race? Because five races really does not encompass the totality of Niskayuna.
Yeah.
So where is that teased out to a granularity that we can really understand what cultural dynamics are at play within Niskayuna as well?
Yeah. I'll send you an article. This is really complicated. The question you asked is very, very complicated. I'll send you an article.
I understand it's complicated, but the school also does this daily, and it shouldn't be complicated for them.
And it's not only schools, right? It's the town, it's the police, it's all of us. So, but there are people who made suggestions of how to address it. So take a look at that article and say, is that one? Because if we can also offer suggestions, that would be helpful, right? So I'll send you that article because there are academics who've made suggestions, whether that would work for us. Okay.
I have one question.
Yeah.
Not one question, suggestion. For the poor, in the brackets of poor, maybe the students, some people may reach out, but the adults, senior citizens,
Yeah.
they are not willing to reach out to
Yeah, that's very
Yeah.
true too.
And the poor also we can reach out because we don't know how many poor families are in here. Because the Niski now is feeding 80 families in Niski. It was a nice amount of people, families. Who, So I think we should put the working poor as well as the poor, poverty rate.
But senior citizens is a really good point. I hadn't even gone there, but you're right. We have a lot of aging senior citizens in Niskayuna that are staying. They're staying in their homes, and there's not necessarily resources for them.
And they are very shy about talking, come out.
Because it's Niskayuna, right?
Yeah, because I can tell you a story because we used to go to the I'm a senior, okay. I belong to senior center. Now I don't go, but we went to a food pantry with our bus, and some of the white people were very angry. How can you take the Niski bus to a food pantry? What are you thinking? You cannot go. And in that bus, some of those people has no resources for their food, and they were shy and they were hurt, including myself because I was
embarrassed.
Ride or whatever reasons. We all went. It was a nice experience, but after that we couldn't go. With that instance, some people insulted the people.
And you said Niski bus, it was the town bus or the school bus?
No, the senior center, we have a bus.
Yeah. Okay.
So that bus.
And that's true. Niskayuna isn't as connected for senior services as other places are within the county.
No.
There's a huge gap missing for
solely from Niskayuna. Yeah.
I would agree. Great point.
And also people just, even if the senior center, we go there, people say, you don't pay enough taxes, still we are invited, you are part of, you can become a member. So things like that, it hurts. But senior citizen, senior aging population is a big thing to reach out.
Right. We are an aging community, so that becomes very important. Yep. All right. So then I am over here. So one of the suggestions, one of the reasons I gave all this data was we have to come up with some kind of a recommendation for what do we track annually for the town. And of course, we do it more often, but for the town, it's helpful to have some kind of a way to check our progress annually. So here are some suggestions, and I don't have the data, but I know it is there. And sometimes I don't have a data, but I think it's important. So I know in the subgroup, we talked about grade third, 5, English, and this comes from St. Louis, uh, and math kind of competencies by race, uh, race, ethnicity, color, disability, what else? ESL, right? I don't know if they'll give us this, but if they've given it for AP, because you cannot take an AP class if you don't get good at math and English, right? And that's what they were counting with the equity cities. So I wondered whether we can get grade 3 English and grade 5 math. I think that's what they counted in the cities, uh, along with the AP. The other one I was going to suggest, we had, this is what the police report had, is, I don't know where am I here? Over here, belonging. Now this is, I don't even know how to measure it. There are several tools out there. So it'll take us time to study how to measure belonging. And but there is like resources. But I think it's important to figure out whether people feel safe and feel like they belong in Niskayuna. So this I said is I don't know, but it's something we could consider figuring out how to do it. In terms of opportunity to thrive, this is what the school district is already doing. So we can ask them, staff in entry level and senior positions, they're looking at this. They are.
That's a funny part.
My husband works for the district, and I got to tell you, no, they're not.
They said they are, so I'm going to take their word for that.
They do a lot of talking,
Okay,
not a lot of doing.
And it's funny, all the good important people are leaving from Niskayuna, so that's I don't know what's the plus point or minus point at this time. And I don't know, we can talk about politics in here. Some of the people are concerned about the politicians time limit in the board.
Yeah, no, we can't.
Even though some of them are a lot of issues with some people, but they are still there. And the supervisor to the lower grade, so I don't know. It's very confusing and frustrating, and we don't know where to go. Look for how can we teach our children what is right and wrong.
Yeah. So what we should do is because find out what we would like to have done. So I'm just putting this down because I was trying to think of of what we can measure annually. And I put this down because then we can think about it and discuss it in September. Volunteers in committees. This is easy to look at. Niskayuna has a lot of town committees. Affordability, housing affordability. I think you can get here home ownership. Alice, this is the United Way. And here suspensions. And what is not available is restorative practices, what is happening. So I'm going to put, we know a lot about the negative stuff that is happening, but not about.
We don't know what's good or bad anymore. So
Here, and then this is the one we can get, but it'll take some thinking. Well-being, preventive, and corrective. this is, we often tend to be very reactive. Something goes wrong, then we do something about it. What are we doing to prevent it? And what are we doing to make people's lives better? So we can kind of, I think that's the big debate actually with the police reform is the thing is everybody's very reactive. What are we doing to change people's lives so that doesn't happen again? Over here, they have also, I'm sorry, this is what I know. This is the one place I know there's data. Sorry. This is the only computerized systems they have, and they have arrests. So this is data that they collect in any case.
Well, what about just regular calls? It's not a traffic stop if you call the police to come to your house. So what is that considered? If
You know what, St. Louis, those cities, there's cities that are working on these equity issues, and what they use as measures is calls and amount of time, number of minutes to respond to a call, or time to respond to a call. So when you have a call,
it could be a call for a domestic situation, and it's a mental health crisis. It's a teenager who's OD'd, whatever. Like, how does that get tracked? Because it's not a traffic stop or arrest.
Okay, so let's put that as to find out. These are, I don't know.
Emergency calls, because I always call for even if slight.
That would be okay.
Non-emergency.
Well-being, I don't have. So let's think about this a little bit more. I seem to have got a little carried away with opportunity to thrive in fair and restorative practices for all. So we'll think of something over here. But this is just
well-being indicators, right? That global well-being index.
Yeah, we don't really collect that data for the state, for Niskayuna.
Why not?
We don't. I mean, because we tend to be very risk deficit focused. That's why. I mean, it's for the first time, Healthy People 2030 has well-being and their plan, but we don't really collect it. It's not required in the surveys, and so we don't. The only people who really collect well-being is Gallup, which is a private company, and they do this.
But can we change the paradigm and maybe start collecting it?
Yeah, no. So I'll put that as a question mark. Okay. Well-being. Yeah. I'm going to go here because we'll come back to this. I know I'm kind of trying to get through these slide sets. So then our next meeting is Wednesday. It's changed. The time changed because the task force changed their meetings. So Wednesday, September 8th, 6 to 7:30 works for everybody. It'll be like second Wednesdays. September, October. Like I said, this is phase 1 and we are towards the end of it.
When is the task force meeting?
It's what we used to have would be the third Tuesdays. So originally our meeting was supposed to be the following week, but the task force has taken that spot, so we have to change our meeting. So this phase of the work will be done by September, October. I'm hoping we can present to the task force in October because not many of them attended these meetings, and see if this is okay with them. And then we'll begin the next phase where all those yellow highlighted parts, we'll start working a little bit deeper in what we don't know and how to get there and how to ask questions. So let me tell you what happens. So this is another way of presenting what we have talked about so far. So this is racial equity and justice is our grand challenge. Those are the 3 themes. And if we all collaborate across all these groups, these are some major initiatives that we hope to link and align with. They're already happening at some level, either at the county level or at the local level. And so this is the way we are all volunteers, right? So we want to get some institutional buy-in and residents buy-in. So this was one way of presenting that.
The bubble, inclusive age-friendly communities.
Mm-hmm.
age important, definitely, but ability inclusive, something that denotes that other span, whether they're deaf, whether they're blind, wheelchair users, walker users, whatever that, whether it's physical, mental, cognitive, whatever that disability might be, that it's inclusive of all of them.
Yeah. So when I write this up, right, we can put that a little more specific in that inclusive. It does mean not only color. It
Right.
not only means, it means exactly what you said. And the only reason I put that, that's a WHO initiative. And New York is supposedly the first state to have that. Only New York, we only call it age-friendly communities. I just put inclusive because it's possible to have age-friendly communities without being inclusive. And so that's why I put the word inclusive to, and so we'll explain that. So Sabrina, when I write out the description, make sure that those words are there because there's much more behind this. And I know
That
hospitals,
becomes how we interpreted it individually.
right.
So I want to take the implicit and make it explicit.
No, and you're right. And you're right to do that. There are the hospitals, I think, are getting some, I don't know how, they're collaborating with the AARP on this, on age-friendly communities, but we want to make sure the inclusive doesn't get lost when we work with age-friendly communities. So there are people already working on it. We have to make sure we make that connection and, and continue to advocate. So most of this have already people working on it. We just have to see where we want to make the connection. And that's what we'll focus on during the next time, either through key informant interviews, through kind of study groups or discussion groups, a lot of key informant interviews, or even getting stories, narratives, building narratives about what is happening, what is working well. I think if we can show what people are already doing well, it really helps a lot. It may not be in Niskayuna, but it could be somewhere else, and we would want to copy that. It helps people. So anyway, let me go on to the next one here. Oh, Dana. I wanted to give Dana a chance, right? So this is actually very consistent with all the work we're talking about. Part of it is we've kind of jumped into this without really training ourselves. I just expect everybody intuitively to be trained in all these aspects, right? So Dana, if you could tell a little bit about the self-assessment survey.
Yeah. Hi, everyone. I'm Dana. I worked on the survey, and I'm working with the task force this summer. And we just wanted to work on the survey to help or to give everyone a chance to assess their individual and progress of the group in terms of how much we've been participating, and also just to find ways where we as a work group can work more effectively. And that way we can, have better structured meetings or help clarify our goals and make sure everyone's sort of voices are pretty much heard in that. And it's just also a time for us to help reflect on what we can do to be better members for the group. And so generally the survey takes only about 10 to 15 minutes to fill out, and all the questions are like fill in the blank. You don't have to write anything, but there is a section, the very last question actually, where it's open-ended. So if there's anything that the survey didn't address, you can put it there. And you don't have to put your name or anything. You just have to give an estimate about how many meetings you've attended. And then we will then look at all the responses after, I think, August 27th is the last day to fill it out. And then we can evaluate, and then we'll share everyone's responses, not their individual ones, but we'll summarize and share that with the rest of the work group.
Thank you, Dana. And this is a pilot. We have a test group. This survey, we basically took questions from different, people who are working on this issue. And so tell us if the questions are difficult or, just how to do it. But the thought is that we would use these questions to develop trainings for people who participate in this equity work group kind of, work. And it'll also kind of, what we try out on ourselves, we'll be able to use in the community as well. That's the hope. So I think Dana sent out the letter. I think it was August 11th. And so if you haven't got it, just email NISKI Best Practices, and Dana will send it out to you again. Thank you, Dana. I'm going to go on. So this is, I'm going to go on because I want to still leave time for discussion. We still have 25 minutes, right? I just want to get through to this. So what I'm hoping is we'll continue with this reflection at the next meeting, September meeting, and I'll have some kind of a draft report. So make your track changes, make changes, keep raising questions, and we'll kind of, it won't be a very long report. It'll be more visual because I want people to read it. But the idea is we'll present our work at the October 19th meeting of the task force. They'll have some suggestions, we'll add it in, and then we'll start phase 2, where we do maybe key informant interviews, discussion groups, gathering narratives, and start the second phase of the work, which will be more hands-on than this one, which was a lot of reading. And our next task force meeting is September 8th. Like I said, it's going to be second Wednesdays. So here, so on September 8th, and after that, it's October 13th. So now I'm just going to go back over here, okay, to see. I'm going to our first slide. Where I talked about, let's see. Okay, so this is the report outline, right? So we've already talked about why racial equity and justice in Niskayuna. In the process, I'll really describe what we went through. Again, like I said, I'll try not to be wordy. I'll try to be more visual. So this hopefully will not take up too much time. And talk about findings. We've not really had a chance to talk about measures. It's too much for this meeting. I'll talk about it at next time. But each of those circles where we talked about inclusive, age-friendly communities, all of them, I did start writing a description, and it's in the handouts, and I'll go there before we finish. But all your discussions, I'm taking heed. Seniors, we need to include. There is a way of working. Like I said, if we can talk about what we are doing well and give examples of what we are doing well, sometimes that helps a lot in getting people to think, understand where we want to go to. Thinking about how to do well is not intuitive, it's hard work. And if we can offer that kind of assistance, that's very helpful, rather than if we find something that is wrong or we would like better, if we can give suggestions of what a better would look like, that is very helpful. So we'll try to do that. But what is left to be done? We really have not engaged as much with marginalized community members. Our meetings are small, so we really need to go out and meet more. We need to identify and summarize what we want to learn as we talk with people. We need to gather information on institutional practice and assets. We're not starting from ground zero. People are doing some good things. They could do better. And definitely point out what we're doing right, because that helps people listen to us, and then how we can build on it. So it's just a way of working which seems to get people working in the right direction. We prioritize. We have a lot of unanswered questions, and we are very few people. So we'll prioritize which ones to start on. What I could do is, where I could use your help is, I can write up all this, okay, because I'm kind of familiar with the process. Where I don't have as much time to do is, how are we going to what questions are we going to ask? So what are we going to do? I know schools, we want to get a lot of information. What questions we want to ask? What do we want to learn, and how are we going to go about it? So if you could be thinking of that, say this is the question we would like, is very critical for our work. If you can identify, this is the information we want to find out, this is how we would find it out, and these are some ways to find it out. So if you can find out ways other people have done it, that would be helpful. We'll put all of that in the appendices, but it's little more details about how to go about it. Yeah. Is there any other way you think you could contribute, or I can write this up before our September meeting, and then we could discuss it some more. We'll also have results of the survey by the September meeting. But our work now is to summarize all the work we've done, reflect on it, and see what's missing, and how we want to work on it. Yeah. So what I'm going to also go over here. You can see my screen there, right? So I am going to, let's see, show you what I have in terms of, let's see. Okay, this is the data and best practices group and our shared folder. And I didn't get any time to work on this since I was subgroup meeting, but I will have to work on it for the report, a little bit of description. So this is, folks were not very, at the subgroup meeting, many of you said they were not familiar with all these initiatives. So for example, let me zoom this up a little bit more. View. Oops. Okay. So over here, so for example, lifelong learning, this is, as we sit here, the Niskayuna Schools is having a board meeting, and they came up with a vision of an equitable community of lifelong learners. And we want to make sure that the definition of equity is beyond race, color, right? And we can, when we talk with the school, we can talk about that. There are some precedents to this. OECD has done some work on this. This positive and adverse childhood experiences, this is a statewide priority, right? And for a long time, just out of habit, it was adverse childhood experiences. But they found that when you have positive, there's more research saying when you have positive experiences, it can have a healing effect and reverse some of the negative parts. So here are some examples. But like I said, this is a statewide priority for the State Health Department, Office of Mental Health, and OSS. And here are some resources. Inclusive, age-friendly communities. I put the inclusive. For all of us, is age-friendly. Again, it's a statewide priority. Now over here, the last one actually compares, there are lots of different ways to go about it, but this one compares, a New Zealand report compares which one is more inclusive and how to go about it. Circular economy, I just put that up. I see Laura's on the call. It tends to be most of the foundations that are working on it. Europe is very big on it. The United States, it's a little bit of a patchwork here. A little bit of work in New York City. And then community wealth building is again a statewide priority for the Department of Health. And there's again good resources out here. Policing, I was in a bit of a hurry. I think there's much more than I've put over here, but I put some references. Climate is very huge. I know that I know, Laura, you just got a grant, right, to work on smart climate initiatives or something?
We just submitted for one.
Oh,
So
submitted.
hopefully we get it. Yeah.
Okay. So anyway, so this is over here in the handouts part of the shared initiative. So if you know of any initiative we can link up with, it's good, because then we have more partners and we kind of align and kind of get more people to, it adds validity to our work, and we also get more advocates with us. So what do you think so far? That's a lot.
I think it's absolutely amazing amount of work that you have done, Preeti, and it's really helpful and good and kind.
Oh, Thank you, Laura. No, we have a great group in Niskayuna. There's lots of strengths in our community. So if we can engage more people, that would be great. So I guess next steps is I'll write up the draft report. I'll send out any questions you have, in emails. I'll make sure to include it in the draft report, right? We're not prioritizing at this point. I'll just kind of put it all together. These are questions people suggested. But I think we'll begin prioritizing in November. Any other questions? Yeah?
Preeti, I have a question for you.
Yeah.
The climate change and the Niskayuna has a lot of new association developing, like a tree committee, and Ashok is doing a pesticide, things like that. I don't know. Do you want to reach out to those people or what?
Yes, at some point.
Yeah.
At this time, we're still planning, right?
Yeah.
Because there are a lot of these climate committees in the town, I noticed.
Yeah.
And so this conservation committee
Right.
and tree council. So yeah, so if we don't want to spread ourselves thin, right? So let's get what we want to know and then figure out how do we go it so we're not like burnt out before we even start. So at this point, it's still very much trying to figure out what we know, what we want to prioritize, who are the committees, how do we go about it, who goes about it. So, because eventually I'm hoping by next year we can make some recommendations to the town.
One more
But
thing, Preeti,
yeah,
before we finish. There is a moon catcher project going on, which is a big thing for Niskayuna Rotary Club. It's also the putting towards that to the climate change a process, and they submitting that project to the UN. I don't know how to mingle with us, our
moon.
project. I don't
It's
know.
called moon catchers.
Yeah, the moon gadget is a big, huge project for the Niskina Rotary doing for the, especially in the African countries. A girl named Alice Marcus is doing that project in Nigeria. She's from there, and she's doing a tremendous job. Same with the Ailey. She started that project, and
But it's
they're
not for
going
Niska.
to Uganda, Malawi, all those African countries.
So it's the students working globally, but not in Niskayuna.
This is a elder lady working, but the students can join that. But
Okay.
Rotary Niskina Rotary Club is doing that
We'll
project.
keep that. Yeah, we'll keep that in mind.
Yeah,
Write that down. If you have any kind of website or information on
yeah,
it,
yeah. I can
send it
send
in.
you
Yeah.
all those
Yep.
information.
All right. I am done. I can see Sabrina looking really tired there. Sabrina, are you tired?
Okay,
All
you're
right.
still sharing your email screen with us.
Oh, am I? Yeah, it's an Niski best practice. Yeah. Thank you. I know this is being recorded, right? I should be careful.
That's what I was just. You probably
Can I
yeah.
announce a public announcement?
Yes.
We have a Niski Farmers Market every Saturday, and the Niski Day is on this Saturday. Please join us and help us.
All right. Okay. Thank you, Liz. Anybody else? Any other questions? Any other thoughts? Dustin, thanks for pointing out the years. That was a uh, good catch. And I appreciate all of you really participating. Sometimes people have said, "You're doing all the work. I'm not doing anything." But it's just helpful to present it. This is like really tedious work. And I'm hoping our next phase will be much more interactive. But this needs to be done before you go to the next phase. Otherwise, we end up doing things that people are already done. So you kind of have to know what's already being done before we go on to the next phase. So I'll write that up by September. I really appreciate you all listening. If you can give me any suggestions, I've always wondered how to address this complexity thing. I want people to understand we are working with complex issues, that it's never done. It's hard, it's overwhelming, but there are ways to work on it. And I know people just kind of say, "What are you talking about? Let's go on with the real stuff." But to get people to understand how to work with complex problems is important, because then You know you never get done, but you know what, you have to always be looking for how to adapt. You're always looking for unintended consequences because it's not a simple problem. It's just the nature of complex problems. But people usually find that very abstract. But any case, uh, that's all from me. I think I'm done. We're going to be done early. It's 7:20, 10 minutes early, which is not bad, right? All right. Well, thank you all for participating. We'll talk again on September 8th. Before then, I'll send you a draft report to comment on and we can discuss that. All right. Well, thank you all.
Thank you.
Yeah.
Okay.
Thank you.
Yeah. Bye.
Bye, Laura.
Oops, bye guys.